Hello friends, let us now learn some important points about alpha blockers in antihypertensives. Blockers, we can them into non-selective and selective. Non-selective alpha blockers will block alpha 1 and alpha 2 receptors. So these include number 1 phenoxybenzamine, which is used as drug of choice in pheochromocytoma. Phenoxybenzamine is irreversible alpha blocker which has longer duration of action. Then we can also use phentolamine. This phentolamine is actually used as drug of choice for cheese reaction, and it is also a drug of choice for clonidine withdrawal syndrome. Then we have selective alpha blockers. Selective alpha blockers which are used in hypertension are prazosin. Prazosin is actually used as is a drug of choice for hypertension and benign prostatic hyperplasia. This prazosin is actually safe in diabetes mellitus, coronary artery disease and gout, because in coronary artery disease it will improve the lipid levels. So if you see the side effect of prazosin, it causes first dose phenomenon or postural hypotension occurs in due to prazosin. Postural hypotension occurs due to prazosin. Then if you see the next group of drugs which are important in this antihypertensives is vasodilators. So vasodilators, the first drug is sodium nitroprusside. Sodium nitroprusside, we will see the mechanism of action. This sodium nitroprusside will generate nitric oxide. So this will generate nitric oxide. Now nitric oxide increases the cyclic GMP level, which causes vasodilatation. So it can cause both arterial vasodilatation and also venular vasodilatation almost equally. So it causes both arterial and venular vasodilatation. If it causes arterial vasodilatation, it increases the peripheral vascular it decreases the peripheral vascular resistance, decreases the afterload, and thus decreases the BP. If it causes venular vasodilatation, it causes pooling of blood in the veins, thus it causes decreased venous return and it decreases the preload. Because of decreased venous return, it decreases the cardiac output, and finally it decreases BP. So either it causes arteriolar dilatation or it causes venular dilatation. The final effect would be decrease in BP. Then if you see, this sodium nitroprusside is unstable and it rapidly decomposes on exposure to light. This sodium nitroprusside rapidly decomposes on exposure to light. So the solution should always be prepared fresh, and once it is prepared, even the infusion bottle and the entire drip set, all of that should be covered with black or amber colored paper. So the infusion bottle or entire drip set should be covered with black or amber colored paper. The short duration, it has a short duration of action, that means it has shorter half-life, and we can use IV infusion. It is given as IV infusion in 5% dextrose, that is equal to 0.5 micrograms per kg per minute. So because of its shorter duration of action, we can use this sodium nitroprusside, can be used as drug for hypertensive emergency, and it is rapid acting drug, and the dose of this sodium nitroprusside can be titrated. So these are the important points about sodium nitroprusside. Then if you see the uses, sodium nitroprusside is preferred in hypertensive emergency. At present, we have second line. It can be used as second line drug in hypertensive emergencies and heart failure. So if you see the side effect, it also causes hypotension. It also causes, if there is overdose, this causes anorexia, nausea, vomiting, fatigue and disorientation can occur whenever there is overdose of this sodium nitroprusside. Whenever there is overdose, it also causes cyanide accumulation. This cyanide which is accumulated causes toxic psychosis, it causes metabolic acidosis, and it also causes hypothyroidism. So it causes accumulation of cyanide causing toxic psychosis, metabolic acidosis and hypothyroidism. Now we can also use in the treatment of cyanide poisoning, like hydroxycobalamin can be used in the treatment of cyanide poisoning. Cyanide, whenever there is cyanide, this cyanide here, this will cause accumulation of thiocyanate. Cyanide combines with sulfur and forms thiocyanate accumulation, which will inhibit the thyroid gland functioning and causes hypothyroidism. Then this sodium nitroprusside is contraindicated in pregnancy. Then the next group of drugs are potassium channel openers. So potassium channel openers. So when the potassium channel opens, the potassium goes out of the cell, that is potassium efflux occurs, which causes hyperpolarization, causing the blood vessels to relax, thus causing vasodilatation. Especially there is arteriolar dilatation followed by venular dilatation. Then if you see one important point, the one drug, that is hydralazine. This hydralazine is a potassium channel opener, and it also releases it also releases nitric oxide from endothelium. It also releases nitric oxide from endothelium. This hydralazine is metabolized by acetylation, so it is genetically determined due to slow and fast acetylers. Now this hydralazine is used in hypertensive emergency, in pregnancy, and in congestive heart failure. So if you remember, this slow and fast acetylers is also important in isoniazid drug. So hydralazine is used in hypertensive emergency, in pregnancy, and it is also used in congestive heart failure. Side effect of hydralazine is it causes drug induced lupus. Then second important drug is Diaz Oxide. This Diaz Oxide is actually a potassium channel opener, which causes smooth muscle relaxation. It also inhibits the beta cells of the pancreas and thus decreases the insulin release, causing hyperglycemia. So because it causes hyperglycemia, it is contraindicated in diabetes mellitus, whereas it is drug of choice for insulinoma, because in insulinoma, insulin causes there is increased release of insulin, which causes hypoglycemia. So if you give this Diaz Oxide will increase the release of insulin, and thus this Diaz Oxide will decrease the release of insulin, thus counteract the increased insulin release from insulinoma. Then the next important drug is Minoxidil. This Minoxidil is a prodrug. This Minoxidil, in the presence of the liver, it gets converted to minoxidil sulfate. So this Minoxidil is used in patients with chronic renal failure. It is used in patients with chronic renal failure because levels are not changed in chronic renal failure. In chronic renal failure, the minoxidil requirement is not changed. If you see the side effects, there is abnormal hair growth on the body causing hypertrichosis, and there is also increased hirsutism in the patients. This is actually contraindicated in females. Then this hypertrichosis, because of this hypertrichosis, it is FDA approved androgenic alopecia. So it is approved for androgenic alopecia by FDA. Then other side effect is it causes reflex tachycardia, and it also causes headache. So this hair growth has two important implications, because it causes abnormal hair growth and hypertrichosis. Because it increases hirsutism, it is contraindicated in female, whereas because of its ability to cause abnormal increased hair growth, it is used in alopecia, and it is approved by FDA for alopecia. Then the next important drug is phenoldiprem. Phenoldiprem is actually a vasodilator, and it is a D1 agonist. It is a vasodilator and D1 agonist. This phenoldiprem is used in hypertensive emergency. It is used as drug of choice in IV nicardipine. Then it is also used as post-operative hypertension. The drug of choice in post-operative hypertension is esmolol. Then calcium channel blockers. If you see the calcium channel blockers, they are L type of calcium channel blockers. L type of calcium channel receptors are present in CVS. So these calcium channel blockers are of two types. One, they are dihydropyridines, and second we have non-dihydropyridines. So in dihydropyridines, the drugs include nifedipine, amlodipine, philodipine, isradipine, nimodipine, clevidipine and clinidipine. So first, the drug nifedipine, amlodipine, philodipine and isradipine, all these will act on blood vessel smooth muscles and they cause vasodilatation, and thus because they cause vasodilatation they increase in BP. So because they are acting peripherally in the blood vessels, they are called as peripheral calcium channel blockers. Then nimodipine acts on brain and it is preferred in subarachnoid hemorrhage. Then clevidipine and clinidipine are used in hypertensive emergencies and they are nephroprotective. Then the drug nicardipine has fast onset of action. It has faster onset of action and it is used as drug of choice in hypertensive emergencies. So these are the important points about dihydropyridines. Then we have non-dihydropyridines. In the non-dihydropyridines, we have the drug verapamil. Verapamil is used as drug of choice in ventricular tachyarrhythmia, and verapamil is used in drug of choice for ventricular tachycardia. So the site of action of non-dihydropyridines, that is verapamil and the diltiazem, is heart more than blood vessels. Because they are acting mainly in the heart, they are called as central calcium channel blockers. Thank you for watching.